The low incidence of large and small bowel cancer in India is often attributed to natural antioxidants such as curcumin in the diet, the yellow pigment in the spice turmeric, which is used in curry powder. However, it's imperative to recall that beneficial effects attributed to diets are seldom reproduced by administration of a single ingredient in that diet. For example, diets rich in beta-carotene lower the risk of tobacco-related cancers, but the administration of beta-carotene pills does not. That doesn't stop researchers from trying, though. Back in 2001, in a last-ditch attempt to save the lives of 15 patients with advanced colorectal cancer that didn't respond to any of the standard chemotherapy agents or radiation, they started them on a turmeric extract. It appeared to help stall the disease in a third of the patients, 5 out of 15, suggesting turmeric extract may cause clinical benefit in at least some patients with advanced refractory colorectal cancer. Now, if we were talking about some new kind of chemo, and it only helped 1 in 3, you'd have to weigh that against chemo side effects, losing your hair, sloughing of your gut, intractable vomiting, maybe being bedridden. So in a drug scenario, a 1 in 3 benefit may not sound particularly appealing, but when we're talking about a plant extract shown to be remarkably safe, even if it just helped 1 in 100, it'd be worth considering. With no serious downsides, a 1 in 3 benefit for end-stage cancer is pretty exciting. To see if colon cancer could be prevented, 5 years later, researchers at the Cleveland Clinic and Hopkins tested 2 phytochemicals, curcumin from turmeric, and quercetin, found in red onions and red wine, in people with familial adenomatous polyposis. Colon cancer forms from polyps, and there's this disease that runs in families in which you develop hundreds of polyps, which will eventually turn into cancer unless you have your colon prophylactically removed. So they took 5 such patients who already had their colons removed, but still either had their rectum or a little intestinal pouch, which were still packed with polyps. This is where they started out, between 5 and 45 polyps each, and this is where they ended up after 6 months of curcumin and quercetin supplements. On average, ended up with fewer than half the polyps, and the ones that they had shrunk in half. Here's a representative endoscopic photograph before and after. Now you see it, now you don't. But what about patient 1? Got rid of all their polyps by month 3, but then they seemed to come back. So they asked them what's what, and it turned out the patient stopped taking the supplements. Darn it, so they put them back on the phytonutrient supplements for another 3 months, and the polyps came back down. All with virtually no adverse events and no blood test abnormalities. By studying people at high risk for colon cancer, they were able to show noticeable effects within just months. But polyposis is a rare disease. They were only able to recruit 5 people for the study. Thankfully, smokers are a dime a dozen. Another 5 years later, researchers put 44 smokers on turmeric curcumin supplements alone for a month, and measured changes in their colorectal aberrant crypt foci, which may act like precursors to polyps, which are the precursors to cancer. And we can see after just 1 month, there was a significant drop in the number of these aberrant crypt foci in the high-dose supplement group, but no change in the low-dose group, with no dose-limiting side effects, although the stools in the participants did turn yellow. The USDA recently removed their online antioxidant database of foods, concerned that ORAC values were routinely misused by food and dietary supplement manufacturing companies to promote their products. Supplement manufacturers were getting into my ORAC is bigger than your ORAC pissing contests, comparing their pills to the antioxidant superfood du jour like blueberries. And we know there's lots of bioactive compounds in whole plant foods that may help prevent and ameliorate chronic diseases in ways that have nothing to do with their antioxidant power. So I understand their decision. So should we just eat lots of whole, healthy plant foods and not worry about which ones necessarily have more antioxidants? Or does one's dietary antioxidant intake matter? We have some new data to help answer that question. Dietary total antioxidant capacity and the risk of stomach cancer, the world's second leading cancer killer. 500,000 people studied, and dietary antioxidant capacity intake from different sources of plant foods was associated with a reduction in risk. Note they say dietary intake. They're not talking about supplements. Not only do antioxidant pills not seem to help, they seem to increase overall mortality. That's like paying to live a shorter life. Just giving high doses of isolated vitamins may cause disturbances in our body's own natural antioxidant network. There's hundreds of different antioxidants in plant foods. They don't act in isolation, they work synergistically. Mother Nature cannot be trapped in a bottle. Similar results were recently reported with non-Hodgkin's lymphoma. The more ORAC units in food we eat per day, the lower our cancer risk may drop. Though antioxidants are not greens, were particularly protective. Look at that. Going from eating like 1 serving of green leafy vegetables per week to more like a serving per day may cut our odds of lymphoma in half. Should we be worried about antioxidant intake during cancer treatment, since that's how most chemo drugs work, by creating free radicals? According to some of the latest reviews, there's no evidence of antioxidant interference with chemotherapy, and in fact, they may actually improve treatment response and patient survival.